After a tooth extraction, some soreness is normal, especially in the first couple of days. But if your pain suddenly becomes sharper and more intense a few days later, you might be dealing with dry socket. This is one of the most uncomfortable complications after a tooth is pulled, and it can significantly slow down your recovery. Dry socket occurs when the blood clot that should naturally form in the empty socket either doesn't develop or gets dislodged too soon. Without it, those sensitive areas are exposed, causing sharp, throbbing pain that can radiate to other parts of your face. Most cases appear between 2 to 5 days after the extraction, right when you might think you're in the clear. There are a few main triggers for dry socket. Smoking is a big one. It reduces blood flow to the gums and can physically dislodge the clot. Poor oral hygiene allows bacteria to interfere with healing. Some extractions, especially impacted wisdom teeth, carry higher risk because they cause more trauma to the tissue. The most telling sign of dry socket is pain that gets worse instead of better. This discomfort can spread to your ear, eye, temple, or jaw on the same side of your face. You might notice bad breath, an unpleasant taste in your mouth, or swelling. In some cases, you can even see exposed bone where the tooth was removed, a clear sign that the protective clot is missing. If you suspect dry socket, your dentist will examine the area to see if the clot is absent and may take x-rays to rule out other problems, like leftover fragments of tooth or bone. Treatment often starts with a gentle rinse to remove any debris. The dentist may place a medicated dressing inside the socket to protect the bone, reduce pain, and encourage healing. In some cases, prescription pain medication or anti-inflammatory drugs are used to manage discomfort. Follow-up visits are important to monitor your progress and change the dressing if needed. At home, you can support healing by rinsing gently with warm salt water, sticking to soft foods like yogurt, scrambled eggs, or soup, and avoiding anything that might disturb the clot. That includes smoking, alcohol, and using straws. Good oral hygiene is important, but brush carefully around the surgical site to avoid knocking anything loose. The best prevention is following your dentist's aftercare instructions exactly. Those guidelines are designed to give your body the best chance to heal smoothly and avoid complications like dry socket. You should call your dentist right away if your pain suddenly increases after the first couple of days, or if you notice swelling, a foul odor, or exposed bone. Don't assume it will just go away on its own. Untreated dry socket can prolong recovery and make eating, speaking, and sleeping very uncomfortable. Quick action means faster healing and fewer complications. Don't wait and suffer through unnecessary pain. Call the Oaks Dental Center today at 805-499-1111 to get expert care and ensure a smooth recovery after your extraction.